Has anyone here ever stubbed their toe or had a paper cut? We all have at some point in our life. Now just imagine that pain times 10, times 20, times 30. And unrelenting. It never goes away. It never lets up. This is what chronic pain is. Chronic pain is an overpowering, all-encompassing event in a person's life. It interferes with thinking, actions, and sleeping. Today I will be addressing a specific type of chronic pain called Complex Regional Pain Syndrome, or CRPS. CRPS is a chronic pain syndrome most often affecting one of the limbs, an arm, a leg, a foot, or a hand. It is characterized by prolonged, excessive pain and skin changes. According to the National Institute of Neurological Disorders and Stroke, 90% of the cases manifest after an injury or trauma to an affected limb. Interestingly enough, you don't have to injure the entire limb. You can injure a very small part, even a finger or a toe, and it'll cause your entire arm or leg to be affected. Now, why does this matter to me? I have this syndrome. It originally manifested in my right arm and right leg after I had a cervical fusion with a bone graft in 2014. There are two types of CRPS. Type 1 affects individuals without a confirmed nerve injury. This is much rarer than type 2. Type 2, of course, is people with confirmed nerve injury, and this is where I fit in. CRPS is caused by damage to or malfunction of the peripheral and central nervous system. There are many triggers that can cause CRPS. Fractures, sprains, strains, soft tissue injuries such as burns, cuts, or bruises, limb immobilization such as being in a cast for a long period of time, or surgical or medical procedures, something as simple as an immunization or as severe as a surgery. Any of these things can be triggers and set off CRPS in any affected body part. CRPS represents an abnormal response that magnifies the severity of the injury. For some reason, the pain information that is sent from the injured area to the brain is magnified, and you experience severe pain. In a lot of ways, CRPS is similar to an allergy, whereas some people respond to the triggers that others it has no effect on. It is more common in individuals with other inflammatory or autoimmune conditions such as asthma. There are a couple symptoms that set CRPS apart from other syndromes. The most dominant one, of course, is pain. The pain is constant, prolonged, and severe. It may feel like a burning sensation, like there's molten lava in the bone marrow of your body. It may feel like pins and needles, like your body part is always asleep. Or it may feel like a squeezing sensation where you may have, it feels like someone is wringing out your body part like a wet rag. I experienced the burning and the squeezing sensation. In rare occasions, it does jump to the opposite extremity, an uninjured extremity, one that's never had a problem, suddenly has CRPS in it. There's increased sensitivity in the affected area, such that even light touch or contact is excruciatingly painful. I experienced this when I was in the hospital getting rehab. They would put baby powder on my arm trying to desensitize it, and I couldn't stand the feeling of the baby powder. According to the Mayo Clinic, the skin changes can be characterized by white and mottled look to the skin to a red and swollen look to the skin. You may have hair and nail changes where the nails on the affected limb grow faster. You may have an abnormal sweating pattern, whereas you get sweating in the affected limb where other parts of your body may not be sweating, or vice versa. And your skin may become very thin and fragile, much like diabetics, where you can get pressure sores and ulcers. According to the Mayo Clinic, after the skin changes occur, the condition is often irreversible. There are a few treatments for this syndrome. Some of them help for longer periods of time and some of them are short term. Rehabilitation early on may eliminate or prolong the time until debilitation occurs. So this is probably the most important step to take if you develop CRPS. There are also medications that help. Pain medications, narcotic pain medications, and non-narcotic can all help in different ways. You can take anti-inflammatory medications to help with the swelling and pain. And seizure medications help with the nerve injury pain. The next type of treatment that is very common and very near and dear to my heart is spinal cord stimulation. This is where they implant leads into your spinal cord area. When you feel the pain sensation in your body part, it is interrupted by the leads, and you feel it never get the pain sensation, the pain signal never gets to your brain, and all you feel is a tingling sensation as opposed to pain. This is important to me because I had one implanted 2 weeks ago. The last ditch effort treatment is intrathecal drug pumps, where they implant a drug pump into your spinal cord area, and it bathes your spinal cord area with medication directly in the fluid that bathes the spinal cord. This helps because you can use much smaller amounts of medication. It helps eliminate addiction, and it helps eliminate the problems that medications can cause for your body. There are some experimental procedures out there that are new and not used regularly. There's ketamine injections. This is when a low dose of ketamine, which is an anti-inflammatory and pain-relieving medication, is given intravenously over several days. This has been shown to reduce or eliminate pain. However, it's very hard on the body, and you have to be put in a medically induced coma to receive this kind of treatment. There's only one place in the United States where you can even receive it. Another experimental procedure that's done often, and this one can be done anywhere, is a hyperbaric oxygen chamber. They place you in an overly oxygenated room, and the extra oxygen is shown to reduce inflammation and pain. And occasionally, very rarely, people go into spontaneous remission, where they wake up one day, 10 years later, 15 years later, and the pain is gone. CRPS is a debilitating syndrome. It is chronic with very few long-term solutions. You experience constant, prolonged, severe pain. You experience increased sensitivity to the affected limb. You can experience skin changes. You can experience different sweating patterns and hair growth. There are many different things that cause this to be a debilitating syndrome. Chronic pain is an overpowering, all-encompassing event in a person's life. It interferes with thinking, actions, and sleeping. Today we looked at a specific type of pain called complex regional pain syndrome, or CRPS. In conclusion, you now hopefully have an understanding of this life-changing problem.